Stevens with Connecture. Want to thank you so much for taking the time out of your busy schedules to join us for this presentation today. I want to take just a few minutes to go over some housekeeping items, and then we'll get started. So first of all, you should be able to see a title slide on your screen, Connecture's 2015 Consumer Survey. If you're having any problems seeing that slide or viewing the webinar, please email marketing@connecture.com, and we will try to assist you as quickly as possible. Secondly, I wanted to explain how we're going to ask questions. So due to the size of the audience today, all participants are in listen-only mode. However, if you would like to ask a question, we'll go through all questions at the end of the presentation, but ask them at any time. And to do that, there is an orange arrow in the top right-hand corner. Just click on that, and if you click on that and go down to the questions section, then you can type in your question, and we will have that then to answer after the presentation. If you don't see that orange arrow, please feel free again to just email your question to marketing@connecture.com. So once the presentations are done, we will go through as many questions as possible. If for some reason we don't get to your question, we promise you that we will personally answer it via email after the webinar is over. So on the next slide, you'll see that we have a disclaimer slide. As a public company, we are displaying this slide solely to inform you not to make any investments based on what you hear today. So we have to display this and give you that little blurb. So now on to the fun stuff. Let's introduce our two speakers for today. First, we have Chris Justice. Chris is the Senior Director of Analytics for Connecture, and he leads all of our analytics and reporting initiatives. He has 28 years of experience in providing analytics and consulting to employers and health plans. His specialty areas are in the development of healthcare financial and predictive models, as well as reporting solutions. In addition to Chris, we also have Christopher Neuharth. Christopher is the Vice President of Product Design and User Experience at Connecture. And what that encompasses is managing all of our product experience design and implementation. That includes consulting with clients, overseeing and managing all of our consumer research, which we're going to talk about a little bit today, user interface development, usability testing, as well as analytics measurement. So now that you have some background on our speakers, I'm going to get it started, and Chris Justice is going to kick us off today. Chris?
So sounds like we might be Chris.
Yep, we can't hear you, Chris.
I'll jump in and just get over the overview of survey design and objectives. So what we're going to be covering today is we're going to be giving an overview and some insights into a survey that Connecture sponsored over in February 2015. So this is something that Connecture has been doing for 3 years now, and I've been noticing some trend on healthcare behavior. It's a 45-question set that we delivered to 2,200 respondents, and the main reason for that amount of respondents was to get some understanding of different breakdowns by market segment. So we balanced the audience pool across age, income, gender, and educational status to match a typical commercial population. So we've got people in here that have group-sponsored coverage, individual coverage, Medicare coverage, etc. We'll be focusing a lot of our attention on individual and Medicare, but there's going to be a number of insights from a group employee kind of shopping experience as well as you look at private exchanges. Generally, our goal is to match this against the U.S. Census data. So the objectives say, what is this survey really targeted at? Is that we're looking for trends in healthcare consumer behavior. How do people shop? What kind of help do they want in shopping? What products and features do they value? Really, how do we optimize that experience, and how do we take some of the pain out of the process? So it provides a very robust data set that we utilize, from both from a new product development perspective and how to enhance features, as well as kind of diving deeper into the mind of the healthcare consumer.
And Christopher, Chris just had a minor phone problem. He is now back, so you can turn it back over to him.
Well, that's okay. I'm right on to my next slide. So.
All right.
So what we're going to cover today, because we didn't want to go through 100 pages of survey analytics, we're going to talk about the 8 big points we want you to think about over the course of this presentation. So number 1, consumers would prefer to help themselves but fail. We'll talk a little bit about the sort of the quest for independence and the ability for people to self-serve and make their own decisions. Point 2, people will shop around. This is something we see from a behavior perspective of it's not a single channel type of experience. That we'll talk a little bit about how people guide themselves through the consumer journey. Number 3, don't count clicks, count confidence. This is meant to be a little bit provocative in the title about saying, well, it's not all about click counting. This is really trying to dive deeper into how do people complete the sale? How do they go through this process and really get enough confidence to continue? One size does not fit all. Personalize that assistance. This will be a theme that you'll hear throughout the presentation. Choice matters, but not as much as advertised. I won't steal the thunder for that part. The doctors matter, but loyalty has its limits. Obviously, a big discussion point across the industry is, the rise of sort of new plans, new networks, trying to find ways to carve out care, have lower cost alternatives. We'll look at what type of consumers, what they're willing to trade off from that perspective. And yes, people actually do buy health insurance on a phone. We'll talk about some mobile analytics and kind of attitudes around research and shopping and enrollment on phones. And then last but not least, certainly, is we'll try to dispel the rumors that health plans are just looked at as sort of a non-trusted entity by consumers, and that brokers are completely going extinct. And we'll give some evidence to the contrary. So the first point, consumers would prefer to help themselves but fail. So the way we look at this and say, how do we look at a consumer's initial confidence? So we ask them questions around, how, sort of give your confidence level about shopping for health insurance. Do you feel confident enough to go about this completely on your own? Do you want to go, maybe you're going to try it, but you're going to need some guidance along the way? Or the upper 12% there that say, look, I know that I'm going to have troubles doing this. I'm not even going to attempt it myself. I'd like someone to guide me to the plan. And so you look at that and you say, over 80% of the market says, you know what, I want to give this a shot. And in reality, these look like big buckets, but it's going to be a spectrum of consumers. Maybe they just need a key question answered at some point, and maybe they just need a nudge along the way. What really happens, as you see in what happens in reality, is these consumers come in, and logically they're going to be confronted with so many different questions. How does this all work? What type of plans are available to me? How do tax credits work? How do I get access to this? What are the different Medicare programs available to me? What am I missing? And then typically they'll get a number of those questions answered, and then they'll get often caught in a whirlpool where there's, am I sure, am I willing to actually commit to this? It's a considerable amount of money. And so there's all sorts of different channels for them to get out of that process. Largely though, they're going to either work with a broker or contact a call center or look for some sort of, human assistance to get them out of that whirlpool. And so what really happens in reality, and how does this become sort of a paradox, is that realistically across the board, and this is true in under 65 business and over 65 business, is that maybe a fifth of consumers, 20%, really say that or actually complete this 100% self-service. So 80% of people need some level of guidance along the way. Now that does not mean that 80% of the consumer market is broker-driven. There's a big gray area in between. Contacting somebody, asking a question, sending emails, looking for all sorts of different channels. And we'll talk today about what are all the different ways that they find to get out of that? But think about this in terms of how does the whole industry move that 20%? We have, there are people that actually have 0% because they've chosen not to go direct to consumer, or you have certain plans that are up to almost 50% completely self-serve. So there's a lot of different strategies that we'll talk about today. So the other key point to think about in this is that from an employer perspective is that although it's the norm, when we ask people about do you want your employer to choose your health plans on your behalf, that's actually the lowest rated choice. Only 20% prefer for an employer to choose. So this gets to kind of the notion of independence as well. Well, we certainly acknowledge that the employer creates an umbrella of trust overall, that people are somewhat comfortable with the process of selecting from their employer. They do have sort of a starting point of independence and the desire to complete it on their own. The highest rated ways to go about shopping were, to use websites that provide personalized recommendations, or just, basically, I'm going to stick it out. I'm going to look for these things on my own. I'd like to do my own research. I want to feel confident about that. The other key point to think about here is that this is not something that most people have done before. This number has moved slightly over the last few years, but primarily across the market, whether because they've had traditional group insurance, or they haven't been able to afford individual insurance, or they just worked with somebody who helped them. Most people have never shopped online for health insurance, so 78% of people. So, of that 22% that have, it's a very experience. Oftentimes they find it confusing. There's lots of different options out there. There's all sorts of different channels. I've got questions to answer about my finances, my prescriptions, my doctors. So it's a difficult process, and we're just at really the starting point as an industry in how do we smooth out the bumps and make that so we're creating more of a informed and confident consumer. So really, what do we do about this? So really, we look at it and say, what you need to do is put the consumer at the center of the value chain. It's work outwards. Even though the consumer may be 20% of those, completely self-serve, you can see that there's a desire to increase that. People want to be independent. They want to be informed. They want to make these decisions as much as possible. So we need to empower them to make those choices and provide them just enough targeted and timely assistance to get them over that. And then from a sort of a segmentation perspective is work to profile those consumers early on where they lie on that assistance spectrum, and say, yes, this is a person likely to self-serve. I'm going to kind of push them through the process and kind of introduce these online tools. Or, hey, I found somebody that really is not comfortable with this. Let's get them to the right channel so you're maximizing your own tools to reduce the overall cost of acquisition. So number two, people will shop around. So, we ask people, where do consumers start their research? So I've heard that I have to go get a plan. Maybe I'm turning 65, or maybe I just heard about these exchanges. Where do I start? So the top result in that is 51% of people say they're going to begin their research by looking at health insurance plan websites. So they're going to be heading out to your website or your competitors' websites, and they're going to be doing a little bit of hands-on research. And this really, you think about it, even though sometimes we buy a product on Amazon, we go around and we do research products, and we look and say, what are all the different options available to me? I want to look in depth. I want to look at the source of data. 48% of people say they're just going to start in search engines. I'm just going to go out to Google. I'm going to start typing in key terms. I'm going to try to teach myself a little bit about buying health insurance. This was the first year that we've been giving this survey that online research actually trumped family and friends. So unfortunately, we now trust the internet more than our own family, but that is the next result, is that 42% will seek information from family and friends. Now, that's self-reported. As we know in real behavior, is that people are going to, as they're researching, they're going to be talking with people, and they're going to be asking sort of questions about other people's experiences. But this is really, when you think about where they're going to start the process. Only 23% of people said that they would start researching for a health insurance plan out at a public exchange. So a number of different reasons for this, but really I think it kind of points to the fact that if people are looking around, they want to be prepared before they get put into that type of environment. 17% of people said that they would start by just calling a broker. And that sort of lines up pretty closely with what we showed on the previous slide about the people that say, you know what, I know I'm not going to be able to do this, just let somebody help on behalf, where that was 12%. Very similar type of behavior here. So the key thing to kind of take out of this is we also asked people that enrolled on health insurance exchanges. Did you visit websites health insurance plan websites before enrolling? And 70% of exchange purchasers actually visited a health insurance website prior to enrollment. So there's a significant opportunity to capture that person's attention, answer questions for them, and possibly enroll them right there on the spot. So if they run into trouble, along that way, what are they going to do? So you saw that 17% would start with brokers, but 45% of people overall said they're likely to call an insurance broker to help. And that lines up pretty close to reality of what a lot of health plans see about how much broker-driven business it ends up being. 36% of people said they're likely to walk into a health insurance store for help. So this number has actually risen over the last few surveys and shows a likelihood for a number of people that might be a good channel. Maybe I want to go in and I just want to talk to somebody face-to-face, and it's sort of a dedicated store. 34% said that they would go to a seminar, something educational to help them through that process. 18%, interestingly, would walk up to a stand in the mall. So you see the big difference here between the other question was framed as a standalone health insurance store versus a stand in the mall. A lot of people have a greater reluctance to do this as far as just walking up to kind of an average person in the mall in a busy place. So a little bit lower numbers here. So those are more human interaction type of ways of seeking help. But what other ways can they get out of trouble? So 62% of people would use an online plan advisor tool to help find a plan. So this was the #1 result in our survey because it's non-threatening to consumers. They can get in and just sort of self-serve, as we showed from their desire for independence. They would go about this. This lines up pretty close to what we see in reality. We have with our sites today about a 70% utilization on those tools. And we do see a lot of people reaching out to them either right away or even after they get overwhelmed and while looking at plans. They're going to use those tools. 44% of people said that they would chat online with a health insurance advisor. So this presents a real strong opportunity to say, what's a lower cost way I can kind of nudge a consumer along, and maybe answer a key question or two, or maybe just tell them, look, yeah, you had it about right. Give them the confidence to proceed in that transaction. So what's important? What do we do about this? So people are used to searching on dozens of sites to find the right products. I gave the example of the person that might purchase on Amazon, but they're going to go to the source to research products. That helps them get better answers. On your own websites, you need to help people complete their mental buying checklist. So go answer the questions that they need to answer. Does this plan cover my doctors? Does it, what's the approximate cost over the course of the year? How does it treat my, handle my particular prescriptions or conditions? So that you need to sort of check all these things off, which is where oftentimes human help has to intercept. Capture information to reach out to consumers who do need that nudge. So as much as possible, encourage the ability for them to email plans, save it for later, contact somebody, have somebody contact them, because maybe they're very close to making that purchase and they just need a few unanswered questions. But fundamentally, consumers will shop with you first. So do what you can to increase that forward momentum. If they've got their mental checklist answered, they have help available to answer the rest of their questions, then you can increase that forward momentum and convert that sale before they go to another channel. So number 3 about don't count clicks, count confidence. So every bit of research out in the market about this says that access to information alone is not necessarily the problem. It may have been a problem years ago before healthcare reform when access to true product rates and information was a barrier. But in a world where quick access to lists of plans and rates is readily available across the internet, it's not necessarily speed or kind of a number of clicks to that answer that is the problem. It's about getting over the hump and getting people through enough confidence to complete a purchase. So what we see in reality is that people are going to reserve a small window of time to do this and then rush. So most people decide in a week or less of time, but in that week they can tend to be very busy. So an average consumer, commercial consumer, may visit the site up to 3 times or approximately 3 times before they complete an enrollment. So this shows you that they're engaged, they're looking, and they're looking for ways to get through the process. For Medicare consumers, they're a little more careful, and they can actually, before a successful enrollment, visit as many as 5 times before they self-serve. And what you see oftentimes there is that maybe they do a lot of their research independently, but the final transaction is done by calling somebody up. Only 23% of people that actually convert and do this themselves are first-time visitors. So that just kind of underscores that some people maybe have done research in another area and have just come to enroll, but oftentimes that they need to be kind of come back, let it settle, research a little bit more, and then complete. So I think just to underscore this again, it's not access to information that's the problem. It's the understanding and getting them through that process. However, there's a change in behavior for renewing customers where many of them may just look for convenience and say, I'm generally happy with this, kind of, let me just click through. We've got the image down here for sort of the Amazon one-click. Maybe not quite as simple because it's a more complicated transaction, but really how do we, for those that are confident and just want to continue, just get out of their way. So, except for the resilient 20%, and I'll talk about them in a second, people are in a hurry. So we ask people, how long would you spend online providing information about yourself to help guide you towards the right plan? Because this is really the key question, is that if we know we need to get people through the process, are they willing to do so? So the auto insurance commercials obviously were very popular because people generally have that 15-minute time frame in their mind. So 43% of people, say sort of up to 15 minutes is the amount of time that I would spend providing. Another 19% said 30 minutes seems reasonable. I'll do that kind of for the trade-off of finding the right plan. As you work up, the numbers go down. So 14% of people say that they would spend an hour going through the process. And then only 5% say they would spend 2 to 4 hours. But there's an interesting view onto this, that there's a percentage of consumers that are unique that say that they would spend as long as it takes. 20% of people say, this is an important decision. They're the stick-to-itiveness and sort of the rational consumer that's going to try to make the right decision for themselves. And you'll see that as sort of a segment of the population across all of these metrics. But it's an interesting kind of point of view that really, if you want to capture a large percentage of the market, you don't want to have something that's too onerous. You try to get that 15-minute time frame and hopefully get them the right type of answers. And this really holds up across most age bands. So across all different market segments, about that 20% pretty much holds true. Those people are going to take as long as it takes to find the right plan. You see a couple of unique segments. 26 to 29-year-olds across the board, and all of our different metrics, are slightly more impatient and quicker to just make a snap decision on cost alone. And then as you work your way up, you see that as people kind of get the higher brackets of 75 plus, they're going to look and say, well, just let me see something. You also sort of see a growing impatience with providing information. I just want to see some plans. But generally, these hold true across most age bands. So the other thing to remember in this process is that stress levels are quite high. So 58% of consumers say they are concerned they will have financial problems if someone gets hurt or sick. 55% say it's stressful that that they feel like they can't afford any options. 51% have stress of what it would really cost over the course of a year, and 43% have stress over just the number of choices. So it's very kind of all these concerns kind of going into the process. I'm doing this in a short amount of time. I'm very stressed out. Now the one difference here is when you talk to Medicare consumers, it's obviously less over the financial and cost issues due to the structure of the program, but the same amount of stress is there around, whether their doctors are part of a plan or whether they, cover certain conditions and prescriptions as well. So, what to do about it. People are stressed and operating a narrow window of confusion. So, provide the shortcuts through the process. Provide them ways to kind of answer some of those things. So either through online advisors for those willing to go through that, cost estimation tools, even shortcuts like people like me. Describe these products and say this is something designed for people like you or people in sort of this life stage. Establish your key performance indicators around consumer confidence, though, not simple metrics alone. Don't just look at it and say, what was the overall cycle time, right? Can we move the overall conversion time from 14 minutes to 12 minutes? That might not be the best way of looking at it. You really want to look at overall what's the consumer journey? Where are they getting stuck? What's your overall conversion rate? And where are the problems? So you need more than just raw web data to do that. You're going to need to work and survey consumers, get some qualitative data in that process, and find ways of programmatically reaching out to them to solve those questions. So one size does not fit all. Personalize the assistance. You've heard this somewhat throughout, but diving a little bit deeper now that we've discussed how that they're willing to provide information, what do they actually want to do? So you can see people are willing to provide their doctor names, prescriptions, preferred plan options to find plans. That's about half of consumers. Half of consumers say that they want a bundle of plan choices tailored to people like them. So, it's kind of package it together for me and tell me, what they are. Don't just give me a giant list of products. Answer a few questions regarding their lifestyle, seeing potential health events. So you can see there's a lot of popularity in pockets here around all these that say, yeah, I'm willing to do that. I want to provide some information. I want to see what others are buying. When you kind of add all of that together, so 75% of the population overall would like to provide some sort of information to improve the shopping experience. So high percentage of people that say that they would provide information to help guide them to the right plan. A little bit higher number, though, would also like to just be shown choices. So either plans chosen by other members or sort of modeling scenarios based on given health events. Obviously, there's a considerable amount of overlap between these numbers. So individuals that are a little bit more comfortable with the shopping experience want Medicare members certainly express a preference to share doctor and prescription information, and we're also the group most interested in seeing bundled plan choices. So the real opportunity here to say, this is really something that was crafted around people like you, and here's how to get a shortcut through the process. These do vary a little bit by age band, as we talked about. People that are a little bit more likely to want to see plans that are most frequently purchased by others like me, that trends much younger, kind of more in line with what you see kind of modern e-commerce experiences across the board, or those that are just want to come in and say, I want to model a list of potential health events and what they would cost me if I chose that plan. Also something that trends to the sort of younger and certainly healthier demographics often is that, I'm not here trying to solve a particular question, but I want to see the ABCs of how health insurance works. So, what to do about that? So don't look at decision support as a one-size-fits-all solution. You need to provide enough options so that you satisfy each of these particular segments, whether they be age segments or just really comfort level with shopping. Everybody's got a particular situation, and you need to apply, a segmentation model and a personalized experience around your consumers. So certainly don't get in the way of those who feel comfortable. Don't make any of this mandatory. Don't make it hard for somebody to just buy something if they want to. But keep in mind that that's a smaller percentage of the market. And then provide robust and transparent help to those who need it. And this is a key point, is that we find from consumers that they want things that don't give magic answers, but tell them sort of what the trade-off analysis is. So yes, this plan covers your doctors, but yes, it's also 10% more. Are you willing to make that trade-off? And I think we need to treat people with a sort of a sense that they're going to understand this, and we want to give them the right information to make a good choice, not just something that's a quick shortcut. So real quickly about choice. Choice matters, but not quite as much as advertised. So there's the overall movement in the industry is about more and more choice. But what we find from consumers is that for most of them, choice doesn't mean 100 plans. It means 5 to 10 might be about right. So 76% of people consider less than 10 plan choices a good amount. They don't need a whole lot more than that. 14% want 10 to 20, and then small amounts of people say they want everything in the world. But I think this is a key point, and say in order to satisfy the perception of choice, it may not take quite as many options as previously assumed. And really, the other way of looking at this is say, well, is that because people don't have choice today? And so we also ask people how many health insurance plan choices are offered to you by your current employer, to see that maybe if people were exposed to more plans, that they want more choice. And that's somewhat true to a point. So as people had more options available to them, they desired more choice. Up until you get to sort of a cliff and say, okay, as soon as they get to 5 or more plans, they've had that experience, they say, yep, that was enough. I don't need any more than that. And they get sort of comfortable maintaining that level of choice. So on the Medicare side as well, 72% of retirees preferred a similar level of choice to what they currently enjoy. So this kind of underscores this, is that people don't want to give it up once they have that available to them, but it doesn't mean they necessarily need everything in the world. Medicare individuals prefer a different amount of choice than currently offered. We're more likely to use a health plan website. So it kind of gets to that self-serve consumer. If I want a whole lot more plan choices, I'm willing to put in the work to do it. So what to do about that? So ease people into the choice. Don't overwhelm them. You have an opportunity to expand that gradually. Maybe if somebody's working with single option, introduce some dual options, 3 options, right? Then work your way up. You don't need to plop them into a world where you're transitioning from one sort of crafted plan to 20 plans. You're going to confuse consumers. You're able to control the offer, so provide meaningful choice. And this applies to certainly the individual market, is that simplify the individual plan offers. As we see from real world shopping behavior, there's a clustering effect as to where people are actually purchasing these plans. So there's an opportunity that if they're not interested, that we as an industry have the ability to really reduce that amount of plan offers. And so overall, you have the opportunity to be what healthcare.gov can't. Try to simplify the amount of choice and get people to those shortcuts, rather than dropping them into a giant site with dozens and dozens of plans. I'm going to turn it over to Chris to just talk about provider choice for a minute.
All right, thank you, Christopher. So, I think one of the market developments in the last couple of years has been, plans with neural networks, and there's definitely been a concern, how will consumers adapt to that? What kind of consumers will find that sort of arrangement important? And, just in terms of all of the choice on the market, how significant in the shopping process is going to be the provider, kind of provider ties. And so when we looked at our survey data, we found that, I guess not surprisingly, price is still the top consideration when people make a plan choice. But keeping the current doctor or having a network that has a good selection of providers, is right there number two. I think a good message or a good thing that came out of the survey for our health plans is that the insurer's brand was a very important. It was like the third or fourth ranked factor for driving plan choice. So the insurer's brand is very important in this transaction still, and that I think that that's definitely an opportunity because they're going to go to your website to do the shopping, to do research, and so the more you can trade on that, I think the better for becoming that trusted advisor in the shopping process. Next slide, Christopher. So a question that we had in the survey was, would you consider switching the doctor if another plan cost you less? And overall, if the price was right, almost 2/3 of the respondents said, yeah, we would consider doing that. We were able to parse the data a little bit, and we looked at individuals with common chronic, self-reported chronic conditions. And of course, for them, it was a lower percentage, but still 41% of the individuals with chronic conditions were not going to rule out of hand moving to a plan that maybe didn't have their current providers in it. So, that's a very interesting message. Next slide, please. Per month in savings. So that's not a $1,200 a year or less would get individuals with chronic conditions, over a third of them, to consider switching, which was again very interesting because you would nominally think of these people as being very tied to their providers, but overall you could get 71% of respondents overall to consider switching for $100 a month or less in savings. So I think the opportunity is there to have those discussions. Again, understanding who might these people be would be helpful, but just the fact that such a large portion of people will consider that is an important thing to consider as people go to market with the neural network designs. Next slide, Christopher. So I think the key things here are to be able to answer those questions about is my doctor in the plan, and if not, being able to show them sort of the range of options where they might be able to get a favorable financial trade-off for moving to another plan, and making that sort of a relatively transparent and obvious decision point for them. So that, I think the to a lesser degree, providing information on how key drugs are covered in a formulary. I think you have sort of similar issues there, wanting to be able to answer that question and then show people the trade-off, in terms of monthly premium versus formulary position for drugs.
Thanks, Chris. The next section, we're really going to talk about sort of a big topic in the industry, but we'll sort of show that yes, people actually buy health insurance on a phone. This shouldn't be sort of a surprising that there's a large movement overall in more mobile shoppers at large, for products, and just certainly the multi-year movement over the last 5 years towards that point. The obvious point on that is that smartphone usage varies by age. This shouldn't shock anybody, and it's certainly not original to our research. But you can see that how dramatic that really looks like when you look at the gray bars here. Where are people saying that they're frequent or daily smartphone users? And at the certainly a 75 plus, that's a very small percentage of people that say they're a daily smartphone user. When you get down to the 18 to 25-year-olds, 80% of them say that they're a daily smartphone user. And from my experience out in the wild, that 20% is probably lying, because it seems like everybody is a daily smartphone user at this point. So you can see real succinctly, though, like how much that movement is occurring kind of across all age bands, especially as you consider that this number will both grow organically across all segments, and as people age into programs like Medicare, that you'll see 30%, 40% of the market that says they're a daily smartphone user. So a very considerable opportunity. So overall, then we also ask people, are you willing to get a health insurance quote on a smartphone? Because that's a whole different thing than are you a smartphone user? And 51% of all the smartphone users are likely to get a quote with their phones. So you can see a real interesting number, kind of like, oh, well, people are willing to kind of search around, and you see this behavior in many different places. So overall, you can see the kind of the breakdown of the whole market, sort of in an absolute sense, that again in this the kind of the how that segments across different age profiles. Next, we're going to talk about obviously one of the big questions then is you talk about how it segments according to age. And Chris, if you want to just talk for a second about how this relates to overall health.
Yeah, so in a way, this is smartphone users are, I think, probably a very desirable demographic group to capture for your plans. We saw, based on sort of the simple self-described health status, that smartphone users in general were healthier, and in fact, ones who were willing to use their smartphone to get an insurance quote were even healthier still. So, this is an interesting bit of intelligence in terms of the sorts of risks that you might be able to acquire through the smartphone channel. And kind of similarly, we were kind of interested to understand how the smartphone users, if there were any kind of key areas where their shopping preferences might be a little different. And, all respondents said maybe 30% of all respondents would visit a state health insurance exchange website for their shopping. The smartphone users were actually a good deal more likely to have visited their state exchange website than overall respondents. Almost 50% higher rate. 45% of the smartphone users would have availed themselves of healthcare.gov or a state marketplace. So that was interesting also.
Thanks, Chris. I think it shows a real opportunity that this is the exact segments that you're looking to target oftentimes in the individual space. One of the key points though is you'll say, well, yeah, sure, they're going to poke around, maybe they'll log in for a little bit, but are they really going to do anything? The interesting thing to keep in mind is that it's not just about a single channel. So this is some information from a third-party source here from Synchrony. that 80% of shoppers start with online research and visit at least 4 retailers before buying. The other thing is that almost half of major purchase shoppers report using a mobile device at some point in that major purchase process. So it gives you a sense that they may start on a smartphone, maybe they're going to save it and they're going to research later, or, oh wait, maybe I had that key question I had to answer. I was researching that plan, I'm somewhere, I'm waiting, and I want to go find if the doctor was in the plan. And so it's not a linear process. I'm not going to always just use one channel as I get through this. I may be jumping around between a number of different things. So what to do about this? So remember that you're not necessarily the consumer in this case. That maybe you're not likely to shop on a smartphone, but you can see that there is a large percentage of the population that is and does today. A very significant percentage of purchases directly on healthcare.gov were made on mobile devices. So provide tools to help the consumers research and purchase on mobile devices, as well as the ability to have an omni-channel or from tablet, mobile, web kind of view. Keep in mind that we live in that omni-channel world. People are jumping around. I'm sure most of you listening today have had the experience of having the television on and also be doing something on your tablet, and then maybe you also get a call on your phone. So it's all around us from an omni-channel perspective. But more importantly in this is to establish the analytics to view that entire customer journey. So understanding where they might go, how they utilize different devices, and how you can optimize that. So last but certainly not least is that health plans are not bad and aren't that bad, and brokers are not going extinct. So we ask people, we've been asking them for many years, of just where do you trust? What are the trusted sources of information when researching health insurance plans? And so private health insurance carriers do rank #1 on this survey. And so they are the most trusted entity, but right behind them is independent agents and brokers. Kind of going down the list, then it's state-run marketplaces are very close to federally run marketplaces. Web-based brokerages, and there was a few examples given, are lower on the list, and partially due to probably just the lack of understanding of those entities, but they certainly rank as a starting point underneath sort of more of the common entities. And then just for kind of comparison's sake, people like Obamacare less than federally run marketplaces, which is sort of telling. So as we've seen previously throughout the presentation, you can't discount these entities. We heard earlier, about how many people go to private health insurance carriers before they go to state-run marketplaces. We've seen, how they'll often end up in needing these human interactions, and that the role of the broker is needed long-term. If you look at the many years that Medicare, Part D and Med Advantage have been out in the market, it's not a completely self-serve market yet, right? Even with the years and years of exchange, there's still a very strong role for the independent agents and brokers in that process. And we need to look for ways of empowering them to be more efficient in selling, but acknowledge that they will be needed. So the presence of exchanges does not negate those other channels. It doesn't mean that those are going away. Remember that stat that 70% of exchange purchases visit the health plan websites. Health plans and brokers are still the most trusted sources of information, and you really need to optimize around your audience and different segments, because people will still need that human assistance. There are certainly shortcuts that we're all seeking to help provide, and ways you can change the overall equation. We've seen large movement in kind of the ability for consumers to self-serve over the last few years, certainly since healthcare reform has come about. But it's not an overnight type of thing, and so we need to look for all these different ways to segment the consumer. So Chris will talk a little bit for a minute here about analytics, and then we'll wrap up.
Yeah, thank you, Christopher. So the consumer survey provides a lot of good directional guidance, and it's a way to start to think about how you would segment your purchasers and begin to understand key differences in their shopping differences and shopping preferences. But it's a starting point, and what you really want to do is be able to align that model, that conceptual model for the shopper with their actual web usage. Because we've seen, even in the earliest slides in the presentation, there's a big gap between intentions and, expressed preferences in a survey situation and what actually plays out in many ways in practice. They still need help, and so understanding who needs what help and when is key, and having the data to do that is essential. So for a given consumer segment, you want to make sure that you can look at the use of the website and identify the desired outcomes. Is it just touches, page views, return visits? You have key decision support modules like a plan compare module or a prescription drug formulary information module or whatever. How many people touch those things and what they do with them is important. And how many people actually set up sort of a user profile or register on your website. And then if they do that, do they move on to sort of the key steps of getting an application going and submitting the application or enrollment. So having clean ways to measure that stuff on your website, make sure that your web analytics makes that transparent. And then you want to know about why things weren't successful. Are there certain groups that just get turned off because of a certain flow in the shopping experience that you have? How do you identify that? How do you narrow that to a segment, or are these broader issues? And then stepping back from the whole user experience, and how do people navigate the site? What are the common flows through the site? And are there some flows that seem to result in closure, favorable closure more than others? And getting at that stuff requires some pretty nuanced analytics on web usage. Next slide, Christopher, please. So again, being able to segment your population and understanding, the behavior for the different segments, and that also allows you to kind of fine-tune your segments, because maybe your jumping off segmentation model, you have some things that you make sense based on survey or intuition, but maybe it doesn't provide as much differentiation as you'd like. So again, looking at the data, letting it kind of guide you to adjust and make it an iterative process is going to be key. People's behavior is pretty complex, and you're going to have to be willing to tinker with stuff and really work through a process. And there may be some low-hanging fruit, and again, that's part of what data analytics can deliver is being able to identify outliers, good and bad, and maybe there's some things that you can do rather concretely to address some of the easier fixes where people are exiting, or where there are just sort of systemic errors in function. Finally, I think there is it's the nature of the beast that in spite of your best efforts to embed tagging and other web analytic devices into your websites to track behavior, there's still going to be ambiguity. It's not always clear why maybe somebody left the website and then returned. And being able to set up situations where you can start to answer those questions where they're really important to answer is important. So you may want to consider things like using, the embedded surveys, which are becoming more and more ubiquitous in web use. They may be the best way to go. Just ask the question directly. As a user, did you get what you needed on this website? If not, what was it that you want? What was it that you were looking for that that we haven't been able to give you? So simple questions like that may be very useful to ask. Christopher, any kind of thoughts or comments of yours in this area?
No, I think you summarized it well. We'll try to finish up here so we can leave at least a couple minutes for questions. So just the 8 things to remember again. Consumers prefer to help themselves but fail. People will shop around. Don't count clicks. Count confidence. Get people through the process. Help them where they struggle. Do it in a personalized manner. One size does not fit all. Choice matters, but not as much as advertised. So you can achieve the consumer's perception of choice with probably less than what you assume. Doctors matter, but as Chris showed, loyalty certainly has its limits, and there are certain dollar values assigned to those limits, depending on somebody's particular situation from a condition perspective. And yes, people actually do buy health insurance on the phone. And overall, the health plans aren't that bad, and brokers aren't going extinct. So with that, we'll open it up to questions.
Okay, thank you, Chris and Christopher. Very limited in time, but I think one question that covers a couple of different areas that you covered is most of the data that we showed was, or that you showed was broken down by age. And there was some interest to understand if we have ever sliced data in different ways, such as income or geography, and does that result in meaningful responses?
Yeah, certainly. We segment the data by income is a very common one, and you see some obviously some pretty stark differences in the willingness to and the stress levels. The stress slide that I went over is going to increase greatly as you get to lower income levels, and it just the likelihood to self-serve goes down even more because the stress levels go up. We certainly look at it from a health condition perspective as well, because I think it's really important to think not just about people in a broad sense, a 35-year-old male in one area, a 35-year-old male in another area may look the exact same. It may have the same income, but one's managing a chronic condition. I think this is part of the message about personalizing the decision support that people have through the process, and really trying to provide them enough options so you hit the right tools for the right person at the right time.
Thank you. So for those of you that had additional questions, since we're so close to the top of the hour, we're going to hold on the rest, and we will certainly send you a response. We appreciate you for joining us today. If you'd like to have any additional information or would like to schedule some time to have a one-on-one or a carrier-specific session with some of our thought leaders, such as Chris and Christopher, please feel free to contact us at marketing@connecture.com. We have recorded this webinar, and you will receive an email with a link to the video so that you can view it again, or you can pass it on to others within your organization that you think might be interested. So thank you again for joining us, and have a great day.